Hi, Timby. Thank you for talking to me. So the alcohol restrictions have shown us two things. One, at policy level, they've demonstrated to us who are the key players in alcohol regulation. That is, who will fight tooth and nail to have less regulation, to have less policy. And they've also given us a demonstration, like a real world, once in a lifetime opportunity demonstration of what our hospitals would look like if people did not drink so much, if we didn't have so many accidents that are related to alcohol, if we did not have so many personal violence that is related to alcohol. So we have like evidence on both policy level, that is, who are the key players, who is likely to fight against alcohol policy, as well as how limited or how reduced alcohol intake would influence our hospitals, like in terms of road accidents and in terms of trauma injuries that come into like our trauma units. Yeah.
And government came under heavy criticism for restricting the sale of booze or banning it altogether at some point in the lockdown. And you say that in its communication, while government's approach was evidence-based, it was not always coherent. How did that work against what was the objective, what government was trying to achieve?
Yeah. So it was not that coherent in that there was like there was this populist narrative that, okay, fine, if we stop, if people drink less, then we can have less accidents on our roads. We can have less gender-based violence, but obviously that is not practical. So there wasn't the health narrative was lost in the restrictions. So there wasn't a way forward that says, okay, how do we use this as to build momentum in maintaining or in instituting proper sustainable regulations in alcohol, so we can reduce we can maybe, for example, reduce or restrict advertising of alcohol. We can restrict sales of alcohol to younger people. We can introduce new labeling restrictions, which are policies that South Africa has tried to implement in the past, but they failed because of the strong industry opposition. So COVID-19 was a way to say, if we had all these ways, if we had these different measures that restrict alcohol consumption, this is what we could achieve. But that was lost in that, like, literally every ministry tried to look at the COVID-19 restrictions in terms of how it would benefit them. So Fikile Mbalula was like, no, then it's good because then we have less accidents on our roads. But then it's not sustainable. It's not it's not something that we can do without infringing personal freedoms. But there are actually other policies that have been on the pipeline forever, but we've been struggling to have them implemented. Like, we've been struggling to implement the limitations in alcohol advertising. So in South Africa, for example, you can walk on the M1 highway and see a big Savannah advert, or a big but then, which is like a very big contrast, because you will have like so many accidents that are due to alcohol, but at the same time, you're driving on the highway, you see an alcohol advertisement. So it was the time to bring all these policies that we've had in the background for a very long time, but then I feel like that opportunity was missed.
What about the strength then of the alcohol lobby, because we've seen it at work in the last 2 years or so?
Yeah, the alcohol lobby is very strong, and that's why I think that the COVID-19 gave the public health lobby, or the pro-public health, or the people's lobby, an opportunity, but that was missed. The alcohol lobby is very strong because they can always bring the jobs argument. They can always bring the we employ a lot of people, a lot of that, but then it's not it's not really like that important when you think of the public health impact of alcohol in South Africa. Like right now, we'll be counting how many deaths are on our roads. So I think, yeah, the alcohol lobby is quite strong, but COVID-19 was an opportunity for the public health lobby if there was more nuanced approach to the COVID-19 lockdown. Say, okay, this is this is what our hospitals would look like if we didn't drink so much. What policies are there to help us achieve this? And I feel like that was sort of a missed opportunity because there was a very the industry was still very strong, but then everyone on the pro ban, on the pro restricted alcohol consumption was pulling to their own little direction without one direction. Yeah.
And do you think, Doctor, that the temporary bans, the restrictions have improved or worsened the situation?
I think the temporary bans, if the temporary bans at least got to show the public that we do have a drinking problem, and if we didn't drink so much, this is what it would look like. What is missing is a way to show the public this is how we get from drinking so much to drinking less. So we need to have proper labeling on alcohol. We need to have less advertising. We need to have less young people less young people start drinking at a very young age. So we need to have these multi-pronged policies to get us to this point. So what the alcohol bans have shown us is that this is what would happen if we didn't drink so much. But they didn't show us how to get there. So we needed a public health voice to show us, okay, we can have labeling policies, we can have advertising policies, we can have restrictions, like policies that restrict sales to certain populations to get us to people drinking less. So what this ban showed us is this is what would happen. This is a beautiful, ideal world, but then we still have this long road of implementing these policies to get us to drink less because the bans are obviously not a sustainable approach.
Dr. Yandisa Ngqangashe, good to speak to you all the way from Australia. Thank you so much for your time tonight.
Thank you, Tembi.